Medical revalidation of Puerto Rico, tricuspid valve endocarditis in IV drug users. Case scenario: a 32-year-old IV drug user presents with fever, chills, dyspnea, and a new murmur. Blood cultures are positive for Staphylococcus aureus. What is the most likely diagnosis? Diagnosis: infective endocarditis, i.e., of the tricuspid valve. IV drug users are at high risk for right-sided infective endocarditis, most commonly affecting the tricuspid valve due to direct venous injection of contaminated substances. Key clinical features of tricuspid endocarditis: fever, persistent, high grade, septic emboli to lungs, cough, pleuritic chest pain, dyspnea, hemoptysis. New holosystolic murmur, tricuspid regurgitation, best heard at left lower sternal border. Positive blood cultures, most commonly Staphylococcus aureus, no peripheral embolic signs, unlike left-sided endocarditis. Duke criteria for infective endocarditis. Definitive diagnosis: 2 major criteria, or 1 major plus 3 minor or 5 minor. Major criteria: positive blood cultures, S. aureus is the most common organism in IV drug users. Evidence of endocardial involvement: echocardiogram showing vegetation on the tricuspid valve. Minor criteria: IV drug use, predisposing condition, fever 38 degrees Celsius, vascular phenomena, pulmonary emboli, immunologic phenomena, rare in right-sided IE. Diagnostic workup: blood cultures before antibiotics. Echocardiogram, transthoracic TTE first, transesophageal E if negative, but suspicion remains. Chest X-ray may show septic emboli, nodular infiltrates, cavitations. Treatment of tricuspid endocarditis in IV drug users. Empiric antibiotic treatment. MSSA endocarditis, nafcillin or oxacillin for 4 to 6 weeks. MRSA endocarditis, vancomycin or daptomycin for 4 to 6 weeks. Septic pulmonary emboli. Continue IV antibiotics. Consider anticoagulation if indicated. Surgery indications for tricuspid endocarditis: persistent bacteremia despite treatment, large vegetations 20 millimeters with embolization, right-sided heart failure due to severe valve damage, fungal endocarditis. Key takeaways for medical revalidation: S. aureus is the most common cause of IE in IV drug users. Tricuspid valve is the most commonly affected. Septic pulmonary emboli: look for nodular infiltrates on CXR. Blood cultures first, then start IV antibiotics. Vancomycin for MRSA, nafcillin for MSA. Would you like